Compression barotraumas. The most common compression barotrauma is that involving the middle ear. While descending, water in the outer ear pushes the tympanum membrane inwards, and in order to avoid the eardrum introflecting excessively, air must be emitted into the middle ear through the eustachian tubes, using a technique known as compensating or equalizing. The tearing of the eardrum causes acute pain, sudden dizziness, and a loss of orientation. And there is also the risk of getting a middle ear infection due to water getting inside the ear. Right from the first few meters of the descent, equalize delicately. If you begin to feel a sensation of tension or slight pain in your ears, ascend a few meters and repeat the equalizing maneuver again. But this time, try tilting your head from side to side until the discomfort disappears. Only after you manage to equalize and the feeling of discomfort disappears can you continue with your dive. Another gas cavity, partly rigid and partly flexible, is the cushion of air trapped inside the mask. Because the face seal is soft, this cushion of air reduces in volume under the effect of the increasing pressure. However, when the mask can deform no further, for example because the rigid frame is pushing against the nose, the pressure inside the mask will be less than the external pressure, and this causes a suction effect or squeeze. This depression causes the delicate tissues, such as the ocular conjunctiva capillaries, to break, leaving the eyes literally injected with blood. In order to prevent these problems occurring, remember to equalize in the first few meters of the descent and blow a little air out through your nose. Other, less frequent barotraumas caused by compression can affect the paranasal sinuses if they are inflamed. In this case, the suction effect during the descent causes them to fill with mucus and blood and also causes acute pain. This can be prevented by not diving when you have any symptoms of sinusitis or congestion of the paranasal sinuses. A very painful but luckily rarer event may involve teeth that are decayed or have imperfect or damaged fillings. During the descent, the pulp and tissues of the dental alveoli may be drawn into the cavity and cause a lot of pain.